The Assessment of Conscious Awareness in the Vegetative State, Coma and Consciousness, by Stephanie Danilak and Rachel Schassberger. Assessing patients in the vegetative state depends on subjective observations of the patient's spontaneous and volitional behaviors. With the development of new technologies, recent studies have used neuroimaging to identify residual cognitive function and even consciousness in some patients with comas. When successful, such studies can lead to a more accurate diagnosis. However, use of these technologies is complex and is still subject to individual interpretation. The Oxford English Dictionary is cited to clarify the choice of the term vegetative state, as vegetative is defined as an organic body capable of growth and development but devoid of sensation and thought. The patient is awake, but assumed to be entirely unaware of self and environment. The term persistent vegetative state describes a vegetative state present 1 month after acute traumatic or non-traumatic brain injury. This does not imply irreversibility. Permanent vegetative state, however, denotes irreversibility. According to the Multi-Society Task Force, 3 months following non-traumatic brain injury or 12 months after traumatic injury, the condition of the patient may be regarded as permanent. The Glasgow Coma Scale is commonly used to assess the level of consciousness and subsequently the severity of brain damage. The patient is evaluated against the criteria of the scale and given a score between 3, which is the lowest score and denotes deep coma or death, and 15, which is the highest score and denotes a fully awake individual. This allows the severity of brain damage to be better evaluated and a more accurate diagnosis to be reached. In the vegetative state, the brainstem is relatively spared, whereas the gray or white matter of both cerebral hemispheres is widely and severely injured. Overall cortical metabolism of vegetative state patients is 40 to 50% of normal values. This drops to 30 to 40% in patients in a permanent vegetative state. This progressive loss is due to progressive transsynaptic neural degeneration. The relatively unaffected metabolism in the brainstem, including the hypothalamus, allows for the autonomic processes to continue working. In other words, the continued function of the brainstem is the reason the trauma did not result in death. Another hallmark of the vegetative state is systematic impairment of metabolism in the polymodal associative cortices, including the bilateral prefrontal regions and Broca's area, among others. These regions are known to be important in functions such as attention, memory, language, and consciousness. While it is unknown whether or not these metabolic impairments are due to irreversible neuronal loss, in rare cases where the patient regains awareness, recovery of metabolism in these areas is observed. Even though this may seem promising for recovery, the mechanism by which this normalization occurs is still unknown. Here are some links to other videos on YouTube where you can learn more about coma and vegetative state.